We're on the record at 10:01 a.m. on May 30th, 2025. This is the Zoom recording of Keith Sanders, MD. The court reporter is Bonnie Smith. Will counsel please introduce himself to state any objection to the witness being sworn in remotely?
James Potts, here on behalf of Arlina Addison. No objection.
Spencer Bomar here for OrthoAtlanta. Dr. Lee, IntraHealth Group, OrthoAtlanta Surgery Center of Austell, and I have no objection.
Olivia Beckett for Piedmont Healthcare, no objection.
Hey, Dr. Sanders, would you raise your right hand? Do you swear the testimony you're about to give in this cause be the truth, the whole truth, and nothing but the truth?
Yes.
Thank you.
You're Keith Sanders.
Yes.
Have you used those email addresses regarding Arlina Addison?
Yes.
Okay. And who did you email?
Spencer Bomar.
Anyone else?
I think one of his associates or someone in his firm, but just those two.
And what email address was it that you emailed Spencer and his colleague?
The neuro
regarding Arlina Addison. Yes, sir.
The Bell South email address.
And the carrier is singular?
No, AT&T.
AT&T? Any other mobile telephone numbers?
No.
What is the number you use for your telemedicine?
I don't use my phone for that, but
All right. Do you know the number that's called?
for what?
Sir?
I don't know what you're asking. I'm sorry.
Do you know what number a patient uses to reach you for your telemedicine?
The telemedicine is done through the Medical University of South Carolina. It's so it's a web-based service. It's not on the phone.
All right. And you were hired by Spencer Bomar in this case?
Correct.
In his firm? Have you worked with Mr. Bomar before?
I have.
About how many times?
Probably 2 or 3 times over the years.
Okay. Do you ever testify about standard of care in any of those 2 or 3 or so times you were employed by Mr. Bomar?
I don't remember.
It was always on behalf of a physician, right?
Correct.
Never on behalf of a patient, right?
Correct.
Okay. You've also done work for Hall Booth,
Yes.
and you've testified for them roughly how many times?
I'd say 3 or 4.
You think it's just 3 or 4?
That's all I can. Yeah, that was my guesstimate.
3 or 4 or more. That's fair, right?
What did you say?
3 or 4 or more. Is that fair?
It's possible. Yeah, I think it's in that range.
And when you testified for the lawyers at Hall Booth, you also testified on behalf of a physician, right?
Correct.
Never on behalf of a patient?
Correct.
Also for Louis Brisbois?
I'd have to go back and look. It's been a couple. I've had a couple of cases with them. Yes.
Do you remember testifying in a case Sumner versus Potts?
Yes.
Okay. You remember the name of the law firm?
I don't.
Okay. Also on behalf of Kevin Race and his firm?
Maybe that's been some years.
I think previously Inslee and Race. Now I think it's Kevin Race.
The distant bells are ringing, but nothing distinctive.
Okay. Do you recall testifying, being employed by Kevin Race to testify in a case?
Maybe. I just can't remember the details.
That would have been on behalf of a physician, right?
Again, I don't remember.
Have you ever testified on behalf of a patient?
Yes.
Okay. And one time you testified on behalf of a patient was in Georgia, right?
I had at least, there have been several where I testified on behalf of patients in Georgia and some in South Carolina and Tennessee.
Do you remember testifying on behalf of a patient in Georgia in a cervical epidural steroid case?
Years and years ago, there was a case where a patient had an injection injury, yes.
Right. And your opinion in that case was also on causation.
I just don't remember. It was a long time ago.
You testified under oath that it was in a case in Georgia where a physician was being sued about improper injection of a cervical epidural, and there were complications. And you testified that did you testify on standard of care? And your answer was causation. Do you recall that?
I don't remember the details. I think it's been 20 years.
All right. When you've given these depositions, invariably you've been under oath, right?
Yes.
Any reason to believe that the court reporter took your deposition testimony down inaccurately?
No.
All right. You're prepared to give your full and final opinion today?
Yes.
And your opinion is not on standard of care, right?
Correct.
Your opinion is, quote, regarding causation, severity of the claimed injury, damages, and plaintiff's prognosis. Is that right?
Correct.
And do you feel like that Arlina Addison is a fraud?
Is that a what?
Would you read the question back, please, Madam Court Reporter?
Question, do you feel like that Arlina Addison is a fraud?
No.
Do you feel like she's faking her injury?
No.
Do you think there's anything fake about Arlina Addison?
No.
Any way to fake a subarachnoid hemorrhage?
No.
Any way to fake free air in your skull?
No.
Any way to fake free air in your spinal column?
No.
Okay. Any way to fake MoCA testing?
The word fake implies that there was intentional incorrect answering. And so, yes, there can be intentionally incorrect answers given.
Any reason to suggest that Arlina Addison has in any way answered falsely or tried to fake the results on either a MoCA or a neuropsychological test?
I have not seen a neuropsychological test on her.
Yes, sir. That wasn't my question, though. Would you read back my question, please, Madam Court Reporter?
Question, any reason to suggest that Arlina Addison has in any way answered falsely or tried to fake the results on either a MoCA or a neuropsychological test?
The question it has a mixed component in that there was no neuropsychological test, so that isn't. I don't think that's a proper question. And then the other part is, if you're asking, can a MoCA result be affected by factors other than just the MoCA than what it's intended to do, which is measure cognition? Can other factors influence a patient's responses? The answer to that would be yes. There are other factors that can influence the outcome of a MoCA test.
So your testimony is that Arlina Addison faked her responses on a MoCA test?
Yeah, that's not what I said. No.
Okay, well, I want an answer to that question. Did Arlina Addison, are you suggesting in any way that she faked any response on any MoCA test?
Yeah, it is possible. I cannot confirm it. I cannot deny it. It is possible.
All right, give me all the evidence that you have that she in any way faked any response on any MoCA test.
In patients like Miss Addison, who have serious, long-standing psychiatric problems, in addition to that, there's chronic pain and there's secondary gain involved when there's a lawsuit filed. All of those factors significantly impact how a patient responds to the questions on a MoCA test.
Yes, sir. That wasn't my question, though. I want any evidence that you have that Arlina Addison, not a hypothetical patient, Arlina Addison faked any response on any MoCA test.
There's no evidence that she faked evidence, that she did fake that.
Okay, so your testimony is, to your knowledge, she did not fake any response. Is that right?
I think that's two different questions. You're saying, did she fake it, or is there any evidence of? There's no evidence of it, but there's a lot of background factors which would influence how she responds to a MOCA test.
You mean that could influence how she responds in a MOCA test?
Yes, it could.
Okay. You agree your deposition is a public document?
Yes.
And have you seen any depositions on our website?
No.
Have you seen some of our depositions on the YouTube channels?
No.
Okay. How many times have you been to our website, jhpii.com?
I would say once or twice.
Well, once or twice? Is
That's
that your best estimate? Okay. And you're in Charleston, South Carolina?
correct.
Are you ever in Summerville, South Carolina?
No.
How far is Summerville from Charleston?
About 30 minutes.
And when you went to our website, what did you review?
What kind of law firm you are and your background?
Yes, sir. Did you review any of our audio recordings?
No.
And you're aware that your deposition will also be available to your colleagues?
Yes.
Okay. To students you may teach?
Yes.
Okay. And you're an assistant professor at University of South Carolina Medical School?
I'm an assistant professor at the Medical University of South Carolina.
Okay. That's a paid position?
Correct.
Are you tenured?
No.
You a full professor?
No.
Are you on a track to being tenured or a full professor?
No.
You teach any courses?
I don't teach courses. I teach medical students and residents in the clinic.
Okay. And what classes do you teach?
No, I said I don't teach courses. I teach medical students and residents in the clinic.
In a clinic, so they follow you in a clinic.
Correct.
Okay. You do any classroom teaching?
No.
Okay. You're not Arlina's doctor, right?
Correct.
Never met her?
Correct.
Never spoken with her?
Correct.
Never examined her face to face?
Correct.
Never taken her history?
Correct.
Never tested her cognition?
Correct.
Never tested her judgment?
Correct.
Never tested her balance?
Correct.
Never looked her in the eye and asked her how she was doing?
Correct.
And you've never treated her?
Correct.
Never talked to her?
Correct.
And you're here to explain what's going on in her head. I think you testified earlier. That's pretty good opinion. Is that right?
I didn't hear the last part.
Yeah. Your opinion, you're here to testify about causation, severity of the claimed injury, damages, and plaintiff's prognosis. Is that right?
Correct.
Would you let someone diagnose your wife or daughter who's never met your wife or daughter?
They would be allowed to review the information and render opinions. That would be appropriate.
That wasn't my question. Would you read back my question, please, Madam Court Reporter?
You're muted.
Question, would you let someone diagnose your wife or daughter who's never met your wife or daughter?
Yes.
Got it. And that's via what, telemedicine?
uh, it'd be electronic methods or telemedicine would be appropriate, it'd be fine.
Other than teaching residents, that's what you do. You provide telemedicine. Is that right?
I have my own patients. I see patients in the clinic and I do telemedicine as well.
Okay. Now, you haven't spoken to anyone who knows Arlina Addison. Is that right?
Correct.
You never spoke with her daughter, Hillary?
Correct.
Never asked her mother, never asked Hillary what her mother was like the morning of the injection?
Correct.
Never asked her how her speech changed
Correct.
or how she struggled to get through a sentence?
Correct.
Never heard how she forgot birthdays?
Correct.
Have you heard that she cried because she couldn't remember her grandchildren's names?
Correct.
First time you heard about that was now?
I think I may have been in Miss Blanchard's deposition.
Okay. And you've reviewed all the depositions that Mr. Bomar sent you?
Yes.
And you reviewed all the medical records that he sent you?
Yes.
And you've got a total of what you've read them all, right?
Correct.
And you've got a total of 7 hours in which you did that?
I think it's been more since that number's was produced. It's probably in about 12 now.
Up to about 12 now?
Correct.
Okay. And you got some recent medical records, I think about a week ago. Is that right?
Right.
Any idea what we just got those medical records two days ago, and you got them a week ago?
I wouldn't know.
Oh, what are your thoughts on that?
I'm not involved in the sharing of records.
Okay. Were you aware that Miss Addison's 7-year-old granddaughter asked her mother why she was smarter than her grandmother, Arlina?
No, I didn't know that.
Okay. First learned that today. Is that right?
Correct.
You've never spoken with Arlina Addison's, any of her treating physicians?
Correct.
Okay. Never spoken with her treating neurologist?
Correct.
Never spoken with her primary care physician?
Correct.
Never spoken with her pain management doctor who performed the injection?
Correct.
Never spoken with any of the ER physicians?
Correct.
Never spoken with any of the nurses?
Correct.
Never spoken with her employer?
Correct.
Never spoken with any of her work colleagues?
Correct.
Did you realize she was a department head when she was working before this happened?
Yes.
Okay. Did you review her transcripts from college?
I did not.
Yeah, I didn't see those in there. Never spoken to any of her friends?
Correct.
Any of her neighbors?
Correct.
Any of her therapists?
Correct.
Her rehab providers?
Correct.
You built your opinion on the medical record?
Correct.
Okay. And that's regarding your opinion that we went over earlier about the effects of Arlina Addison's brain injury, right?
Correct.
I'm going to show you what we're going to mark as Exhibit 1. And the way that I'm going to do this is I'm going to share these in the chat. I'm also going to put them up on the screen so that if you want to open these and look at them on your screen, you're welcome to do that.
Okay.
These will be shared with everyone. And so you provided us with a CV. We'll start with the first one. We'll mark this as Exhibit 1 of your deposition. See where it reads curriculum vitae? Vitae, I think is the way. According to my Latin teacher, you would say that.
It's opening now. One
Can
second.
you, let me, can you see that all right?
I cannot. It's opening. Can you guys open it? Okay.
Are you talking to me?
Well, I was just wondering if the others are able to open the document.
Dr. Sanders, maybe stop trying to open what's in the chat. I think James maybe shared it on the screen.
Okay, now, yeah.
Yeah, let me
now-
do a better job. What I did was I went ahead and shared it by a chat with everyone. So if you open chat on your screen, are you in the same office, Spencer, or no? Okay. If you open chat on Zoom, you'll
Right.
see where, you'll see the PDF there and you can click on that and open it up.
Okay, no, I see it now. It's
Okay.
shared.
And I'll do all the documents like that so that if you, want to look at them, you just let me know, take your time and have a look.
Okay.
All right. So this is your CV, Keith Allen Sanders, MD. That's you, right?
Yes,
And it has here your former home address, 50 Lawrence Street, Charleston, South Carolina, 29401. Is that right?
correct.
And your work address is the Medical University of South Carolina, Department of Neurology. And that address is 96 Jonathan Lucas Street, Charleston, South Carolina, 29425. Is that right?
Correct.
And you've got your telephone, the 404-754-8503. That's your personal mobile, right?
Yes,
And you've also got a work phone you shared with us earlier, right?
I didn't share a work phone.
Okay. And your email is neuro123@bellsouth.net. Is that right?
Correct.
You have a work email as well? USMC email?
Yes,
And what is that address?
it's SANDEKEI at musc.edu.
Uh-huh. And it's got your education, training, honors, and awards. Do you see that? Total of 3 pages.
Yes,
All right. And it accurately reflects your education, training, and work experience. Is that right?
yes,
I'm going to show you what's been previously marked as Exhibit 2. This is, I guess, an updated CV. Is that right? We got from your lawyer yesterday.
okay, correct.
I didn't. Is this any different from the other one?
Just the address is updated. Yep,
The 31 Lawrence Street, Unit 2512, Charleston, South Carolina.
correct.
The work address, MUSC, is the same. Is that right?
Yes,
Okay. And your hospital affiliation is with the Medical University of South Carolina, Department of Neurology, right?
yes,
I'm going to show you what's been previously marked as Exhibit 3. You see Exhibit 3, that's you, Keith Sanders, right?
correct.
And that's still MUSC. That stands for Medical University of South Carolina.
Correct.
Boyd. And it's Center for Telehealth. That's what you do, telehealth. Is that right?
That's one of the things I do.
Yes, sir. In addition to your teaching residents, is that right?
Correct. And seeing patients in the office.
Okay. It reads here the address, which is the same one that's on your CV, right? 96 Jonathan Lucas Street, Suite 301, mail stock code 60, Charleston, South Carolina, 29425. Is that right?
Yes,
Okay. There's a telephone here to make appointments. Is that right?
That's for you pulled this off a website for a hospital in Rock Hill, South Carolina. So that would be if you wanted to make an appointment at their hospital. That's not our number.
So you're not affiliated with Piedmont Medical Center?
Oh, I have privileges there by telemedicine.
Okay. And you're aware that Dr. Lee is employed by Piedmont Healthcare?
Correct.
Okay. And you knew that Dr. Lee was employed by Piedmont Healthcare?
Just to be clear, they're two different organizations, different states. They're not connected.
And I'll object to form Senate calls for speculation.
So is it your testimony under oath today that Piedmont Medical Center, where you're employed in South Carolina, is unrelated to Piedmont Healthcare?
That is correct.
Okay. And point to me any the basis for that belief?
My knowledge about where the hospitals are and their organizational structure, it's two different organizations. They have the name has the Piedmont is a common name, but they're different. They have no connection as far as I know.
So your testimony is that Piedmont Medical Center and Exhibit 3 is unrelated to Piedmont Healthcare?
Correct.
Okay. Dr. Sanders, you weren't there on June 9th, 2022.
Correct.
You didn't see Arlina walk into the clinic alert,
Correct.
independent,
Correct.
full of life.
Correct.
You didn't see her experience decerebral posturing.
Correct.
You didn't see her lose bladder control.
Correct.
You didn't see her lose control of the side of her face.
Correct.
You didn't see her right-sided facial droop.
Correct.
You didn't see her unable to breathe,
Correct.
unable to speak,
Correct.
that she was tachycardic.
Correct.
And you agree tachycardia in an adult is a heart rate over 100.
Correct.
You didn't see her taken out to the ambulance.
Correct.
You didn't see her disoriented.
Correct.
You didn't see her confused.
Correct.
And you're aware, you reviewed this medical record though, right?
Yes.
And you're aware that these things are recorded there, right?
They are.
And they're recorded, I mean, the decerebral posturing was witnessed by at least 3 medical providers. Is that right?
What was the involuntary movements that Ms. Addison had were well described by several providers, correct?
Well, you read the record, you see where it reads decerebral posturing, right?
That's what they called it. I wouldn't agree with that, but that's what they described.
You weren't there, you didn't see it, and you wouldn't agree with it.
I read what they described and I didn't see it, but I don't agree with their conclusion of what it was.
Okay. Have you ever had a patient suffer decerebral posturing?
I have.
And you know what decerebral posturing is?
I do.
So you never spoke with Arlina Addison, never met her, never touched her, and never spoke with anyone who did, including her physician, Lee, or either the nurses that participated in the procedure, right?
Correct.
And you're offering your opinion for pay today, $800 an hour?
Correct.
You know that her daughter cares for her every day
I do.
for free.
I do.
You reviewed Arlina Addison's head CT from June 9th, 2022.
Yes.
Show you what's been previously marked as Exhibit 4. This is an excerpt from her medical record. You've reviewed this.
Yes.
See where it reads Arlina Addison up here in the top right?
Yes.
And you can see my cursor all right?
Yes.
Reads Arlina Addison, that's the patient, right?
Correct.
Plaintiff in this case.
Correct.
Admission, ADM stands for admission.
Yes.
June 9, 2022.
Yes.
And this is shortly after her cervical epidural steroid injection, the CESI, right?
Correct.
You see here where it reads exam, CT head, stroke protocol without IV contrast.
Correct.
Clinical indication, CVA symptoms. CVA stands for cerebrovascular accident. Is that right?
Correct.
Also referred to as a stroke.
Correct.
CVA symptoms, aphasia. What is aphasia?
Difficulty with language or communicating.
And does you agree that difficulty communicating or aphasia is a sign or symptom of a head injury?
It can be.
Loss of consciousness, do you see that?
Yes.
And decerebrate posturing. Is that right?
Correct.
And I think your testimony is that you don't agree it was decerebrate posturing. Is that right?
Correct.
But you've never spoken with Dr. Lee about that,
Correct.
or any of the physicians at Wellstar.
Correct.
Decerebrate posturing after outpatient procedure for cervical spine. You agree that it occurred after an outpatient procedure for cervical spine.
Correct.
She had a cervical epidural steroid injection, CESI. Is that right?
Correct.
And 90 to 120 seconds, according to the people that were there, the physician that was there, she exhibited decerebrate posturing. Is that right?
Correct.
Findings. You see this? There's diffuse trace subarachnoid hemorrhage, most pronounced in the right frontal region. You see that?
Correct.
In the right frontal region of the skull is where the right frontal lobe is.
Correct.
And multiple foci of air in the subarachnoid space. You see that?
Yes.
And you agree that the subarachnoid space or the skull, that's no place for free air. Is that right?
Correct.
And the way she got free air in her skull was from the cervical epidural steroid injection, right?
Correct.
And it reads, primarily adjacent to the anterior right frontal lobe, anterior falx, and at the skull base. Do you see that?
Yes.
What is that anterior falx?
The separation between the two hemispheres.
Right, separates the left and right hemisphere, and it's deep in the brain. Is that right?
Yes.
Okay. Between the frontal lobes.
Correct.
The ventricles are normal in size, position, and configuration. There's no midline shift. And the reason you look for midline shift is to see whether the insult was severe enough to move the brain from left to right.
Correct.
I couldn't hear you. I apologize.
Oh, yes, that's correct.
Yeah. Goes on to read impression, and what the impression, this is from the radiologist, right?
Correct.
You're not a radiologist, right?
Correct.
A diffuse subarachnoid hemorrhage and foci of free air in the extra-axial spaces. Do you see that?
Yes.
Have you reviewed these films?
Yes.
Okay. And you agree with that impression?
The only part I would question is there was also contrast injected during the procedure to find the placement of the needle from the cervical epidural steroid injection. So it's possible what looks like subarachnoid blood could also be contrast dye that was injected and that traveled up to the subarachnoid space. So there's, other than that distinction, I would agree with his reading.
So your testimony is that what the radiologist described as blood was actually omnipaque. Is that right?
It's possible, I'm not a radiologist, but that when you inject dye and you see dense material like this, along with the air, which was also injected, you got to wonder how much of the density is the dye and how much is blood.
Mm-hmm. And cite for me in the history of medicine any treatise, textbook, chapter in a textbook, peer-reviewed article, non-peer-reviewed article, grand rounds, throwaway, anything in the history of medicine that suggests that omnipaque can be confused for blood after a cervical epidural steroid injection when doing a CT of the head.
Won't be able to cite that for you. That's just my understanding of what omnipaque is. It's dense, and contrast can often look like blood. So that's certainly a possibility.
Well, of course, we don't try these cases on possibility. It's on a probability, right? More likely than not. Do you think the radiologist was more likely than not wrong about what he described as blood? And that was actually omnipaque. Is that right?
Yeah, I'm not going to give standard of care opinions about what a radiologist did.
No, that's not yeah, I'm not asking for a standard of care opinion. You're here to testify about causation and the severity of the claimed injury, and that goes to your opinion, doesn't it?
I've told you that I cannot conclude whether it was dye or blood. I do not have the knowledge, training, or experience to distinguish the two.
Right. Then you would defer to a radiologist since you, as you testified, do not have the knowledge, training, or experience, right?
I would welcome their opinion. I wouldn't defer to them. This is an area where neurologists and neuroradiologists work together to come up with the best possible explanation. So I would welcome their thoughts on it.
Yes, sir. So, well, then back to my question. So if you're not deferring to them, even though they have the education, training, and experience, and you do not, what I'd like is a single site. I mean, any treatise in the history of medicine, any textbook, any chapter in a textbook, any peer-reviewed article, any non-peer-reviewed article, any grand rounds, throwaway, anything in the solar system that suggests that you can confuse omnipaque with blood.
I'll be glad to look for that for you.
Sir?
I'll be happy to find that for you. I can't at this.
No, you don't have to. I mean, you're welcome to do, whatever you like, but I believe you testified under oath. You were prepared to give your full and final opinions today. Is that right?
I have given you my full and final opinion that it is not distinguishable by what I know.
All right. So it goes on to recommend a CT angiogram of the head to evaluate for possible aneurysm. Do you see that?
Correct.
And what is an aneurysm?
Weakening in the wall of an artery that bulges out.
Right. And that can cause a subarachnoid hemorrhage, right?
Correct.
But that's not what caused the subarachnoid hemorrhage here, right?
Correct.
Given the symptoms began during a spine procedure, and by spine procedure, we're talking about the cervical epidural steroid injection, right?
Correct.
Recommend MRI of the spine to evaluate for possible hemorrhage. Do you see that?
Yes.
And they actually got an MRI of the spine also. Is that right?
I
If you
believe
recall.
they did. Yes. Yeah. MRI spine on June 9th. Yes.
Goes on to read CT angiogram. And what does angiogram mean?
Looking at the arteries that supply the brain in this case.
Yeah. Exam CT angiogram, neck and head with IV contrast. You see that?
Yes.
So they're using IV contrast here. Is that right?
Yes.
Do you think it's smart to use IV contrast if that's easily confused with blood?
Well, that's how a CT angiogram is done.
Yes, sir. But you testified earlier, you think the blood that these radiologists and neuroradiologists describe as blood, it may be the omnipaque that Dr. Lee injected during the cervical epidural steroid injection. Is that right?
Correct.
And so the mechanism of how that worked, is it your testimony that Dr. Lee injected through the same needle omnipaque and then saline and dexamethasone?
I don't know I don't know which needle he used, but I think he injected all of those.
All of those through the same needle, right?
I don't know which needle he used, but they were all injected into her, what he thought was the epidural space.
You read his notes, right?
Yes.
You haven't spoken with him.
Correct.
You never performed a cervical epidural steroid injection?
Correct.
Never taught one?
Correct.
Never supervised one?
Correct.
Never observed one?
Observed them, but not done them.
When did you observe one?
My wife having 2 children.
Okay, so you watched your wife's, is that right?
Correct.
Okay. Other than your wife's, have you ever observed one?
Yes.
Okay. Goes on to read CV angiogram, neck and head with IV contrast. Clinical indication. Again, CVA symptoms, aphasia, subarachnoid hemorrhage, status post-cervical spine procedure. Do you see that?
Correct.
So according to the physicians that performed these tests and interpreted them, and with education, training, and experience to do so, they're looking at CVA symptoms, the aphasia, and the subarachnoid hemorrhage. And the hemorrhage is blood, right?
Yes.
Nobody writes subarachnoid hemorrhage for omnipaque, right?
Correct.
Or die, right?
Correct.
Okay. And status post-cervical spine procedure. And by cervical spine procedure, what they're talking about is a cervical epidural steroid injection. Is that right?
Correct.
Goes on to read CTA neck. And CTA, that's a CT angiogram, right?
Correct.
We scroll down here. Do you see where it's highlighted head and neck? The brain is normal. No abnormal mass or mass effect is demonstrated. Do you see that?
Yes.
And the reason they were ruling out a mass is why?
It's could be a cause of the involuntary movements, the loss of consciousness, the stroke-like symptoms.
What are they talking about when they write mass?
Pressure and enlarging tumor or blood product. Those are things that cause mass.
Right. But so that's ruled out. Aneurysm's ruled out, mass is ruled out, right?
Correct.
Goes on to read, there's diffuse trace subarachnoid hemorrhage and multiple foci of intracranial air. Do you see that?
Yes,
That's blood and air in the skull, right?
that's what they reported. Yes,
Adjacent to the brain, right?
correct,
And between the hemispheres of the brain, right?
correct,
Most pronounced adjacent to the frontal lobes. Is that right?
correct,
And the frontal lobes, they control certain aspects of a human's behavior, right?
correct,
And one of those is speech, right?
correct.
So it would make sense that when they were talking about one sign or symptom, aphasia, and the difference in a sign and a symptom is what?
Well, symptoms are things that patients report, and signs are objective findings that physicians.
Right. And aphasia, one of her signs and symptoms, if she could describe it, was her challenge with language or speaking, right?
Correct.
And that's a frontal lobe issue, right?
It's not exclusively frontal lobe. The frontal lobe has a part in it.
Nothing's exclusively, well, it's absolutely connected with frontal lobe brain issues, brain injuries, right?
It's the frontal lobe is involved with speech, as is the parietal and the temporal lobes. So those three lobes are involved.
Well, and diffuse, what that means is there's blood a lot of places, right?
Correct.
Not just the frontal lobes, right?
Correct.
No hydrocephalus, is that right?
Correct.
What is hydrocephalus?
I mean, there's enlargement of the fluid-filled ventricles in the brain and backup of the spinal fluid.
But there is pneumocephalus, right?
Yes.
And pneumocephalus, that's the air in the brain, right?
Correct.
And I think you've already testified there was only one way for that to get there, right?
Correct.
And that was a cervical epidural steroid injection, right?
Correct.
Dr. Lee's cervical epidural steroid injection on June 9, 2022.
Correct.
Goes on to read, there is a diffuse trace subarachnoid hemorrhage and intracranial air likely related to recent procedure. You agree with that portion?
Well, just there's, whether it's subarachnoid hemorrhage or omnipaque dye, and otherwise, otherwise I agree with them.
What? I couldn't understand you. Would you repeat that, please?
Yeah, I would say that there's diffuse density in the subarachnoid space, which could be subarachnoid hemorrhage or contrast dye, and intracranial air likely related to recent procedure. That's
okay.
Yeah.
So your issue with this is where it reads subarachnoid hemorrhage, which means blood. You think that may be dye instead of blood. Is that right?
Correct.
Okay. The rest of this, the findings by the radiologist, you agree with, right?
Correct.
History, subarachnoid hemorrhage, status post-cervical spine procedure. That's a history is, that's something you take when you're caring for a patient. Is that right?
Correct.
Were you aware that you inject dye when you perform a cervical epidural steroid injection before you inject drugs and saline?
The timing of when they do all that, I'm not 100% sure on. So.
Okay. You read here, this is at page 39, and for the record, what we've now gone through, what's indicated at the bottom, generated 6/21/2022, 11:57 a.m., pages 37, 38, and 39. Foci of air in the intrathecal thoracic spine. and prepontine cistern, similar to CT, no epidural collection. Do you see that?
Yes,
And so there's also air in the cerebral spinal fluid in the spinal column, right?
correct,
There's only one way that got there too. Is that right?
correct,
And that one way is Dr. Lee's cervical epidural steroid injection on June 9, 2022.
correct.
I was on to read, now we're on page 40, scattered foci of air, subarachnoid space, similar to recent CT, no extra axial fluid collection. You agree with that impression?
Yes,
Down here, chief complaint, do you see this? Patient, 50-year-old female who presented to the ER 6/10/2022 with complaints of episode of decerebrate posturing after outpatient procedure for cervical spine repair and EMS. Noted patient has loss of bladder control during episode. You're aware of that?
yes,
Okay. You're aware she was given fentanyl and Versed before the cervical epidural steroid injection?
correct,
When she came to, she felt like she was aphasic with a drooping of her left side and tingling throughout her body. You're aware of that?
yes.
WU, what is WU?
Workup,
Showed SAH, what is SAH?
subarachnoid hemorrhage,
Patient states that she's still having tingling, mild HA's headache.
correct,
Repeat CT head was stable. Is that right?
correct,
Patient state headaches and peripheral vision loss in the right eye. See that?
correct,
Been confused, left-sided weakness. You agree that left-sided weakness would be associated with a right-sided brain injury
can be,
that has improved since the initial incident, states she's having difficulty concentrating and understanding. Do you see that?
yes,
Concentrating and understanding is the frontal lobes. Is that right?
that and other areas of the brain,
Other areas of the brain also.
correct,
You agree that CTs and MRIs are a roadmap of Arlina Addison's injuries?
I, well, the MRIs of her brain didn't show any injury. So that wouldn't be a roadmap.
I couldn't say that again, please. I just couldn't understand you.
Oh, the MRI of the brain that she had did not show any injury, so it wouldn't be a helpful roadmap.
Now, I believe you testified you've never done a cervical epidural steroid injection, right?
Correct,
You're not a psychiatrist,
correct,
not a neuropsychologist,
correct.
never performed a MoCA test.
I do MoCAs, yes,
Okay. And you agree that a score of 15 is indicative of profound cognitive deficits?
it's an abnormal score, and what the underlying cause of that is would require further testing.
Mhm. You agree that MoCA score of 9 out of 30 is indicative of profound deficits?
It's a very low score, and the correlation with neurological deficits would require further testing.
What further testing? Neuropsych tests?
Yes,
What else?
and input from her treating psychiatrists.
And what?
input from her treating psychiatrists.
You're not a pain management physician?
Correct.
You've never performed any epidural injections, lumbar or cervical?
Correct.
Never used a fluoroscope?
Correct.
You defer to others on needle placement?
Correct.
And you're not here to suggest that the cervical epidural steroid injection performed was safe?
I'm not here to talk about standard of care about that procedure.
At all? Have you ever had a patient that was leaking cerebrospinal fluid into her ear?
Yes,
Okay. About how many times?
a dozen times.
How many? A dozen?
Yes,
Were you aware that Arlina Addison had cerebrospinal fluid leaking into her ear?
no,
First you learned of that is now.
correct.
Okay. And cerebrospinal fluid leaking into a patient's ear is indicative of what?
There's a leak in the the meninges lining the brain. There's a hole, and spinal fluid is leaking out and traveling into the
Right.
ear.
But which is not a good sign, right?
Correct.
Okay. And are you aware that cervical epidural steroid injections into the patient's cerebrospinal fluid can cause leaking cerebrospinal fluid out of the patient's ear?
Wasn't aware of that. No,
Okay. You're aware of it now, though, right?
I'm still not aware of it.
Okay. Have you reviewed any articles in preparation for your deposition here today?
No,
Have you reviewed any articles regarding subarachnoid hemorrhages,
no,
cervical epidural steroid injections?
no.
Nothing like that. Is that right?
Correct.
You reviewed the life care plan?
Yes.
Okay. I'm going to show you what's been previously marked as, are we on 5, Madam Court Reporter?
That's correct.
Thank you. You didn't prepare a written report, right?
Correct.
I've got some correspondence. Now, this is not all the correspondence. I think you said there were some emails. Were there also texts between you and Mr. Bomar? Anyone in his firm?
No.
Okay. It reads here, these are lists of things that you've been provided. The complaint, affidavits, medical records. You see this? This is page 1 of 18. You reviewed all these, right? You've read them?
Yes.
Okay. And then radiology records, you read those as well?
Correct.
You see down here where it reads, no written report is required from you at this time, and that's in bold.
Correct.
What's your understanding about why that's in every one of these letters?
They don't want a written report at this time.
Okay. Goes on to read radiology records from Wellstar Neurology and Wellstar Douglas Imaging. You reviewed those as well?
Correct.
Medical records from Wellstar Neuro Outpatient Rehab,
Correct.
BKMD, that was bookmarked by Mr. Bomar, is that right?
Correct.
Again, no written report is required from you at this time. See that?
Yes.
Medical records from Wellstar Neurology Douglasville, reviewed those as well.
Yes.
Medical records from Wellstar, Carrollton Orthopedic, Joffrey Southmed, Joseph Jellicourse, Marcus Gates, Puckett EMS, Rehabilitation Physicians of Georgia, Summit Spine and Joint Centers, Wellstar Douglas Imaging, Wellstar ENT Douglasville, Wellstar Pain Medicine, and updated records. Is that right?
Correct.
Also depositions of Angela Day, Hillary Faye Blanchard, Arlina Addison, Miranda Dudley, Stephanie Twilley, Linda Krokoff, Turan Subrahamian. Is that right?
Yes.
And you've read all those depositions as well?
Yes.
And what is your understanding after reading Dr. Lee's deposition and Ms. Dudley's deposition about the timestamp on the fluoroscopy images at the time of the cervical epidural steroid injection?
I didn't look at that particularly.
You didn't look at that particular what?
I did not look at that particularly. I didn't pay attention to that.
Deposition of Young, Lee, and Emily Doyle. You read those as well?
Yes.
Then Dr. Dingra, Dr. Odestat, and Dr. Dingra's note. You've read those as well?
Yes.
And Dr. Dingra, I mean, she's a board certified psychiatrist. Is that right?
Correct.
And you saw her notes with her MOCA scores, right?
Correct.
And you've not performed a MOCA test. Is that right? For
I have.
Arlina Addison.
Correct.
Additional medical records now. Page 17 of exhibit. Is this 5, Madam Court Reporter?
That's correct.
Thank you. This is May 21st. So this is May 30th. So this is 9 days ago. You were provided with medical records from Joseph Jellicourse, MD, Rehabilitation Physicians of Georgia, Carrollton Orthopedic Clinic, Jeffrey Southmed, MD, the Neuropsychiatric Clinic, OrthoAtlanta. Is that right?
Correct.
Doctor, you've injected drugs.
Yes.
Okay.
Wait,
You agree before you inject any?
Let's just clarify that.
Sure.
Have I injected drugs on patients?
Yes.
Yes.
Okay. And thank you. You meant, well, I don't know whether you've been.
It's a broad question.
I understand. You've injected patients with drugs. Is that right?
Yes.
And before you inject a patient, you need to know what the drug is,
Yes.
what it does,
Correct.
exactly where it's supposed to go,
Correct.
where it's not supposed to go,
Correct.
the risk of injecting the drug,
Correct.
particularly if it goes in the wrong space.
Correct.
You need to know the patient
Yes.
or anatomy
Correct.
or history,
Yes.
instructions that accompany the drugs.
Yes.
Those instructions, those are referred to as an FDA package insert.
Correct.
And the FDA, that stands for the Food and Drug Administration.
Correct.
You need to know what the FDA warnings are.
Correct.
You need to know what the medical literature says,
Correct.
what your own specialty society says.
I mean, this is beyond the level that I don't have specialty societies that I get involved with injections, so I don't really know about that part.
All right. You need to know that in addition to the dose, the volume of the drug,
Correct.
contraindications,
Correct.
consequences of injecting the drug.
Correct.
Because when the needle's in your hand and you're about to inject it, you don't get to guess, right?
Correct.
You have to know. Is that right?
Correct.
And you agree it's never all right to needlessly endanger your patient or put your patient at risk when you inject a drug. Is that right?
Correct.
And have you ever injected dexamethasone?
No.
Okay. And dexamethasone is a corticosteroid. Is that right?
Correct.
Steroid, right?
Correct.
And it requires a prescription.
Yes.
It requires FDA approval.
Correct.
And FDA approval says what that drug is approved for and not approved for, right?
I suppose I don't inject that medication, so I don't know for sure. But
Okay. Well, in the past, you've injected patients. Is that right?
I have.
Okay. I'm going to show you what's been previously marked as Exhibit 6. And this is the FDA package insert for dexamethasone sodium phosphate. Do you see that?
Yes.
And you don't recall injecting this, is that right?
I've never injected that.
See where it says RX only?
Yes.
And if we scroll down to page, this is 6, do you see where it reads contraindications and warnings?
Correct.
You see where it reads warnings?
Yes.
And those are warnings to a physician, is that right?
Correct.
Those are warnings to a physician that may use that drug on a patient, right?
Correct.
And you agree as a physician, it's your responsibility to read these warnings?
I don't inject this medications, but in general, that's what one would expect the physician. Yes.
Yeah, you read the warnings, right?
Correct.
And you make a decision about whether to put your patient at risk based on those warnings.
In general, yes.
What do you mean in general?
We've gone over this. I don't do epidural steroid injections and I don't inject dexamethasone. So this is not my area of something an area I practice in.
You inject other drugs though, right?
Yes.
And you read the warnings before you inject those drugs, right?
Yes.
And if you were putting a patient at risk, you would let that patient know that you were putting that patient at risk, right?
Correct.
And you would have that patient sign a consent or a waiver. Is that right?
I've never had to do that, so I can't. That generally makes sense, but I've never had to do that.
Well, you want to ensure that that patient knows the risk before you inject a drug that the FDA has warned you is not to be used in this situation, right?
I haven't read this advisory. I don't know I don't know what this is saying. I'm reading that you highlighted areas of serious concern about this medication that have been reported. So I don't know if it's commonly used in spite of this risk. So I just don't know.
Did you read back my question, please, Madam Court Reporter?
Question, well, you want to ensure that that patient knows the risk before you inject a drug that the FDA has warned you is not to be used in this situation, right?
You agree with that?
In general, yes, but you've asked
Okay.
specifically about this, and I don't have any experience, and I haven't read this fully, and I don't intend to.
I will go back to, I apologize. I didn't mean to interrupt you.
Yeah, I don't intend to give expert testimony about when and how steroids are given as an epidural and what sort of warnings are suggested for physicians to, and how physicians to respond to warnings such as this.
Well, you're a practicing physician and you've been identified as an expert in this case, and you're subject to a thorough and sifting cross-examination. You were aware of that, is that right?
Yeah, and you're giving me a snippet of a larger bulletin, and I would have to say I'd like to read it fully to make
Sure.
before answering your question.
Okay. Can you see that all right?
Yeah, you've given me a snippet of a larger bulletin, and I would like to read the whole thing fully before giving any impressions about what it says.
And you're welcome to do that. And if your opinions change and you let Spencer know, and we'll take your deposition again.
Okay.
Do you see where it reads warnings, all right?
Correct.
And you see where it reads serious neurologic adverse reactions with epidural administration. You see that?
Yes.
Serious neurologic events, some resulting in death. Do you see that this drug, according to the FDA required package insert, can result in death? Is that right?
It says there's been cases reported, but nowhere does it say don't use this medication. What I see it saying is the safety and effectiveness of epidural administration of steroids has not been established. So this is sort of this is a warning. This is an alert. This is not a don't use this medicine type of warning.
What it is, it's a warning with the risk associated with using this medicine, right?
That's what we've read so far, yes.
Uh-huh. It goes, and that's something your patient is entitled to know about, right?
Again, I haven't read the full thing. You're asking me to give opinions about.
I'm not asking about the whole thing. I'm telling you, when you inject a patient with drugs and there's an FDA warning you about your use and your injection and your patient, you warn the patient.
I don't read FDA advisories often, so I would have to, I'm saying that's not always the case. I'm not sure.
It goes on to read, serious neurologic events, some resulting in death, have been reported with epidural injections of corticosteroids. Specific events reported include, but are not limited to, spinal cord infarction, paraplegia. Spinal cord infarction. Infarction is what?
A stroke of the spinal cord.
Yes, sir. Paraplegia is what?
Weakness in both legs.
And quadriplegia is what?
Weakness in both arms and both legs.
Cortical blindness.
Damage to the part of the brain that controls vision.
Okay. Which could cause something like a loss of peripheral vision, right?
Possible.
Possible.
It's possible, yeah.
And stroke. And what is a stroke?
Damage to the brain due to loss of blood supply.
Okay. These serious neurologic events, you agree these are serious neurologic events, right?
Yes.
Have been reported with and without use of fluoroscopy. Do you see that?
Yes.
What that means, with or without fluoroscopy, this can still happen to your patient, right?
Correct.
The safety and effectiveness of epidural administration of corticosteroids has not been established, and steroids are not approved for this use. Do you see that?
Correct.
In other words, this drug, according to the FDA label, is not approved for cervical epidural steroid injection, right?
That's what it says.
Yes, sir. I'm going to show you what's been previously marked as Exhibit 7 to your deposition. This is an excerpt from the medical record with drugs that were administered. Do you see? This is page 31 of 33. Do you see orders and the drug down here? Do you see where it reads dexamethasone 10 milligram milliliter injection solution? Do you see that?
Yes,
That's the same drug we were just looking at, right?
correct,
Reads here 20 milligrams. That's the dose.
correct,
Right. And it's at the IV site. Is that right?
correct.
Goes on to read, did you read Dr. Lee's note?
Yes,
Negative aspiration was confirmed. Into the cervical epidural space was infused a solution containing 3 milliliters of 0.9 preservative-free normal saline along with 20 milligrams of dexamethasone. Do you see that?
correct,
That's what he injected. Is that right?
correct.
And do you recall reading the consent in this case?
Because I looked at it, yes.
Okay. And we'll pull up, we'll make this Exhibit 7 to your deposition.
Exhibit 8.
I'm sorry, Exhibit 8. Thank you, Madam Court Reporter. Exhibit 8 is the June 9, 2022 medical record. You reviewed this as well, according to your earlier testimony. Is that right?
Yes,
And you see here where it reads physician Yong Lee, patient name Arlina Addison. See that?
yes,
This is June 9, 2022. Is that right?
correct,
Physician Yong Lee.
yep,
See here where it reads consents.
correct.
Now, I can save us some time if we search this for steroid. It's not in the consent. Is that right,
What was in the name of the procedure?
sir?
It came up was the title of the procedure.
Okay, so you think because it's in the title of the procedure that she consents?
This is not something I do. I don't do epidural. I don't get consent form. But if the name of the procedure includes the word steroid, it would be obvious that there would be steroids involved.
Okay. And that's satisfactory in your view?
Yes,
And that would be satisfactory for one of your patients, right?
correct.
Doctor, your view is that Arlina Addison's CT scans after June 9, 2022 look normal. Is that right?
Correct.
And you're using that to suggest she didn't suffer a lasting injury. Is that right?
That and other information.
Well, that's one of the bases. Is that right?
Yes, it is.
You agree CT scans show structure, not function, right?
Correct.
You can have a normal CT and still have a devastating brain injury.
Correct.
And that's especially true in the frontal lobes.
I wouldn't highlight the frontal lobes. It's especially, it's no more true in the frontal lobe than any other part of the brain.
You agree that, well, the frontal lobes control cognitive function, right?
It is involved in that along with several other lobes.
Yes, sir. Behavioral function,
Same answer.
executive dysfunction,
Same answer.
not just bleeds or masses, right?
I didn't catch that.
Not just bleeds or masses.
I don't know what you mean by that.
The frontal lobes control, among other things, cognitive function, along
Correct.
with other parts of the brain,
Correct.
behavioral function, along with other parts of the brain,
Correct.
and executive function, along with other parts of the brain, right?
Correct.
You would agree the absence of structural damage does not equal the absence of functional impairment?
Correct.
Okay. In fact, many patients with traumatic brain injuries, TBI, is that what you call them,
Correct.
have normal CTs, right?
Correct.
What matters is the clinical presentation,
Correct.
not just the film.
Correct.
Miss Addison was decerebrate according to her medical records.
Correct.
She was aphasic,
She was.
incontinent,
Yes.
loss of control of her bladder,
Yes.
hemiparetic.
Yes.
That's not normal, right?
Correct.
None of those things are normal, right?
Correct.
And that's not explained away by a clean CT later. Is that right?
Correct.
I believe you testify that you have not reviewed any articles. Is that right?
Correct.
And they're not necessary for the formulation or forming your opinion, right?
Correct.
I'm going to run through some articles that you hadn't reviewed any articles on long-term effects of subarachnoid hemorrhages. Is that right?
Um, I did it was a Google Scholar search on the complications of a traumatic subarachnoid hemorrhage versus a aneurysmal subarachnoid hemorrhage.
Well, when you get to subarachnoid hemorrhage, whether it's an aneurysmic or iatrogenic like this one or trauma, it's still a subarachnoid hemorrhage, right?
They're vastly different in their outcomes and their damage they cause to patients. So it's a two very significant split in the road there.
And you base that, again, aside from any treatise, textbook, chapter in a textbook, peer-reviewed articles, non-peer-reviewed articles, grand rounds, throwaways, anything in the history of medicine, that if you've got like in this case, multifoci subarachnoid hemorrhage and free air in the brain, that it's different whether it's caused by if it's caused by an aneurysmic subarachnoid hemorrhage. Anything in the history of medicine.
Yeah, there's well documented that they're completely different.
Well, that wasn't my question though. They're completely different because one is aneurysmic, but it's still a subarachnoid hemorrhage, right?
Yes, but it's the the reason that aneurysmal subarachnoid hemorrhages are so devastating to the human brain has to do with the blood is released in the subarachnoid space at high pressure. It's fresh aneurysm, it's fresh arterial blood jetting into the subarachnoid space. That's completely different than if you hit a vein and you cause a traumatic subarachnoid hemorrhage and it's a slow leak into the subarachnoid space. Air does not cause any long-term effects. Aneurysmal subarachnoid hemorrhage blood does cause damage. Traumatic subarachnoid hemorrhage blood does not cause damage.
Are you saying that Dr. Lee's injection was into a vein?
One possibility of the dense material in the subarachnoid space seen on the CAT scan is that it was due to bleeding from his injection. So it can happen. You can get a bloody tap or bloody CSF, spinal fluid, from a lumbar puncture, whether it's in the cervical epidural or the lumbar epidural space, and that's not harmful.
You agree that when Dr. Lee injected the drugs, the saline and the air, that increased the patient's intracranial pressure, right?
A little.
A little? So show me the portions of the record, or again, any treatise, textbook, chapter in a textbook, peer-reviewed articles, non-peer-reviewed articles, grand rounds, throwaways, that suggest that that's only a little, quote unquote, pressure.
Yeah, I can't quote you on that. I'm going to need to take a break if it's a good time.
Sure. What time is it? 11:30? Okay. I'll see you. How long do you need?
It's 5 minutes.
Okay. See you in 5 minutes.
Thanks.
We're going off the record at 11:31 a.m. We're back on the record at 11:39 a.m.
Did you speak with anyone over the course of the break?
I did not.
We were talking about subarachnoid hemorrhage. Have you read any articles about cognitive and functional outcomes after subarachnoid hemorrhages?
Yes, nothing particular to this case, just general knowledge and experience as a vascular neurologist is a common theme.
Okay. Are there any articles that you've read or that you recall that you're relying on and formulating your opinions in this case?
No.
Okay. Any articles regarding cognitive mental health and quality of life outcomes subsequent to subarachnoid hemorrhage?
No.
Are you familiar with JAMA?
Yes.
Any articles about safety of epidural steroid injections?
No.
Risk and complications of cervical epidural steroid injections?
No.
Motor weakness after subarachnoid hemorrhages?
No.
Neurocognitive sequelae and rehab after subarachnoid hemorrhages?
No.
Neurological complications of CESI?
No.
Avoiding catastrophic complications of CESI?
No.
And by CESI, we're talking about cervical epidural steroid injections.
Correct.
Predictors of cognitive dysfunction after subarachnoid hemorrhage?
No.
Subarachnoid hemorrhage, clinical neuro outcomes, clinical neurological outcomes.
No.
The role of fluoroscopy and cervical epidural steroid injections.
No.
Show you what's been previously marked as Exhibit 9. And you see Exhibit 9,
Yes,
and that is looks like a cross section of someone's brain and neck. Is that right?
correct.
Does that uh, fairly or accurately depict someone's brain, spinal column, spinal cord?
And yes,
I'm sorry, I can.
I would say it's a reasonable
Okay.
visualization.
Yes, sir. And when we're looking at the cervical spine or any portion of the spine, cervical, thoracic, lumbar, what we do is those are referred to by name and number. Is that right? In other words, cervical 1, 2, 3, thoracic 1, 2, 3, lumbar 1, 2, 3, et cetera.
Correct.
And the cervical, I think it's, unless there's some anatomical issue, and there's 7 cervical vertebrae, C1 to C7.
Correct.
Okay. And they start at, you count at the top, C1 down to C7. Is that right?
Correct.
And Exhibit 9, in other words, you would start here where the arrow is and go, that'd be 1, 2, 3, 4, 5, 6, 7. Is that right?
And that's not right.
What?
That's incorrect.
Okay. So how would you count them?
Well, you start at the top, but the long one at the top is actually 1 and 2 combined, and then
Right.
it goes 3, 4.
Gotcha. Thank you. Here, 1, 2, 3, 4, 5, 6, 7. Is that right?
Correct.
1, 2, 3, 4, 5, 6, 7. Is that right?
Correct.
And at the end of C7 is the start of the thoracic spine. Is that right?
Correct.
That would be T1.
Correct.
And you saw in Dr. Lee's notes where he said that he made the injection between C6 and C7, which would be right where the arrow is. Is that right?
I can't see your arrow.
Okay. You see it now?
I think you're below. Maybe you could raise the picture. My picture stops at C5.
Oh, wow. Let's see if I can figure out how to, is that, how's that?
No better. No, it's the same.
Is that big? How's that?
Nope. Make it smaller, maybe.
Here, let me see if I can do it that. How about that?
Yeah, that's better. Do it again though.
Make the whole thing smaller?
Yeah. Oh, there we go. Now.
Okay.
1, 2. Okay.
All right. So this, I think, now you can see now it's a cross. Do you see that? A pointer, we'll call it.
Yes.
And the pointer, 1, 2, 3, 4, 5, 6, 7, that's cervical spine, 1 down to 7. Is that right?
Correct.
And where the pointer is now between C6 and C7, that's where Dr. Lee, according to the medical record, his notes, that's where he injected Arlina Addison, right?
Correct.
And you've read Dr. Odestat's deposition.
Yes.
And where he actually injected Arlina Addison was down here at C7 and T1. Is that right?
Yes.
Okay. You agree it's important, medical records should be accurate,
Yes.
and you should tell a patient what you're going to do
Yes.
and do what you tell the patient you're going to do.
Correct.
Okay. I'm going through some notes. Hopefully a lot of this we've already covered. When we get to something I don't think we've adequately covered, I'll ask you a question again. All right.
Sure.
You agree that blood in the brain, air in the brain, air in the spine, no aneurysm, no trauma, except a needle into the cerebral spinal fluid. That's not a coincidence, right?
Correct.
That's causation, right?
Correct.
Okay. You agree that blood in the cerebrospinal fluid can cause chemical meningitis?
I'm not familiar with that association now.
Do you think that the brain and the subarachnoid space is a place where it's all right to have free blood?
No, it's not.
Okay. And that blood is actually toxic, right?
It can and it's not necessarily toxic. Many people have blood in the subarachnoid space and it causes minimal symptoms.
Uh-huh.
There certainly aren't any permanent effects of traumatic blood in the subarachnoid space. So when you say I'm not familiar with blood causing meningitis, and if it's toxic, it's perhaps very transiently.
Okay. And by transient, you mean the insult goes away. Is that right?
Correct. There's no permanent effects of that.
Well, you can have permanent, you could have a transient brain injury that leaves permanent effects, right?
You can, but traumatic blood in the subarachnoid space doesn't cause permanent brain injury.
Neither does pressure caused by injecting air, saline, and dexamethasone into the cerebral spinal fluid. Is that your testimony?
It does not cause that, correct?
Okay. So your testimony is that while that Arlina Addison doesn't have a brain injury as a result of the procedure on June 9, 2022.
There was no permanent brain damage to her brain as a result of the injection on June 9th, 2022.
Okay. And when do you think that the damage, Arlina Addison's damage as a result of the cervical epidural steroid injection on June 9, 2022 resolved?
About 2 days later, by the time she was discharged, and there had been a follow-up CAT scan on June 13th, which was normal, and then there was a brain MRI in July, which was normal. But yeah, I would say by June 11th, when she was discharged, there was the transient damage had resolved.
Okay. I think we've already talked about a normal CT doesn't indicate there's no permanent injury, right?
Correct.
Okay. But you feel like her normal CT and what indicated to you that her injuries had resolved on June 11th?
Check the form.
You may answer.
I couldn't hear the whole question.
Sure. I think you said her injuries had resolved on June 11th.
Correct.
Okay. And you attribute that to the result of a normal CT on June 11th. Is that right?
And that and other information.
Okay. What other information?
Yeah, the exam by the doctors at the hospital.
Right.
So those are the factors which led me to conclude that the damage from the injection had resolved.
Okay. So you're not familiar with dexamethasone, right?
I prescribe it for other uses, for intravenous use and for oral use. I've used it.
So you do prescribe it.
Correct.
Okay. So you have read the FDA requirements on its use.
I have not.
You've never looked at them?
No. I don't read FDA reports or alerts.
Okay. You agree the right frontal lobe controls executive function?
Amongst other parts of the brain, it does.
Attention and focus,
Amongst other parts of the brain, it does.
judgment and decision making,
Same answer.
behavior and personality,
Same answer.
motor function on the left side,
Same answer.
awareness of self.
Same answer.
And you agree that her CT read subarachnoid hemorrhage most pronounced in the right frontal region,
Correct.
and she now has left-sided weakness?
She does not.
She does not.
She does not.
Okay, and your testimony that she does not have left-sided weakness is based on what?
Her neurologist exam and the video that I saw of her.
Video, what video?
There's a video of her getting out of her car and going in a store, carrying some boxes.
You remember, was it a 64-second video?
Don't know the length.
How many videos have you seen?
Just that one.
Okay. Difficulty focusing, speaking, planning. You aware that she now has that?
Those are complaints or symptoms that she has, correct?
Aphasia, confusion, cognitive slowing. You aware of those?
I know those are symptoms that she has, yes.
Right. Behavioral changes
She has those, yes.
and no longer capable of independent living.
I don't agree with that.
Okay. And these, you suggested that she doesn't, she has those signs or symptoms, but there's another cause other than the injection?
Correct.
Okay, and that's her what, psychiatric history?
Correct.
Okay, anything else?
Oh, and secondary gain due to a lawsuit.
Okay, so she filed a lawsuit for money, making false allegations that she had issues that she doesn't have.
No, that's incorrect.
Okay, then, well, if it's for secondary gain and those aren't really her issues, then that's, she's faking it, right?
No, that's not how secondary gain works.
Okay, how does it work?
Secondary gain is when patients stand to benefit from in some other way from their complaints other than improving their medical health.
Okay.
If the benefit may be being declared disabled or out of work, or if there's a monetary benefit, the well-proven psychological effect of that leads to sometimes subconscious changes in people's behavior and their complaints. It's a normal part of human nature.
Uh-huh. And again, you've never spoken with Arlina Addison or met her, right?
Correct.
You're just saying that's a normal part of human nature.
The concept of secondary gain is a normal part of human nature, yes.
Okay. And what else?
Those are the main reasons that her symptoms are
Okay.
persistent.
And you agree that decerebral posturing is abnormal body posture?
It is.
Indicates severe damage to the brain stem or upper brain structures.
Yeah, but I mean, yes, that's true, but I don't think she had decerebral posturing.
Yeah, I heard that. You said that what the physicians that witnessed what they call decerebral posturing were wrong. Is that right?
Yeah, as a neurologist, even if I had been there, or if there was a team of neurologists observing her, determining whether someone had the involuntary movements and reflexes that she had, determining whether that was a tonic seizure or decerebrate posturing, the neurologist wouldn't be able to determine. So in the heat of the moment, the physician doing the injection and the nurses and the anesthesia staff, they won't be able to tell.
But you weren't there, right?
I was not.
Okay. Um, you see that kind of posturing in a case of major stroke, trauma, or profound brain injury?
You can.
Yep. And it doesn't come from anxiety or stress or mild confusion, right?
Correct.
Comes from an injury to the brain.
It can.
Yeah, and what they described as decerebrate posturing occurred within seconds. I believe the notes read 90 to 120 seconds after the injection, right?
That's what they said. Yeah.
James, I think he hadn't finished his prior answer to your question. Dr. Sanders, did you want to finish your response?
Yeah, just that I disagree that she had decerebrate posturing, but I would prefer that we just call it involuntary movements after the procedure, but that would help me answer your questions.
Well, maybe I can do a better job. What is indicated in the notes on June 9, 2022, and you weren't there, by the physician that was caring for her and witnessed it, was decerebrate posturing, right?
That's what they said.
And decerebrate posturing, period, is indicative of a major stroke, trauma, or profound brain injury, right?
Decerebrate posturing can be associated with those findings. Miss Addison did not have decerebrate posturing, and she did not have any permanent injury.
Okay. And what was described by Dr. Lee, the physician that was there, as decerebrate posturing occurred within 90 to 120 seconds of her cervical injection.
That's what he said.
All right. And what Dr. Lee described as decerebrate posturing was also witnessed by at least 2 nurses, right?
Correct.
And it's documented in her June 9, 2022 record, right?
Correct.
Do you have any opinions that you haven't yet shared with us today that I haven't asked you about?
Yeah, I mean, the extensive psychiatry records from Dr. Randy Warner, which predated by years her epidural steroid injection, document serious psychiatric illness with many neurological symptoms associated with it that were there before the injury, and then that were there after the injury. And then there's a real challenge in the lack of communication between her doctors, between her second psychiatrist, Dr. Dinagra, let's see. Dr. Dingra. There's a complete lack of information between what Dr. Dingra knew and what Mrs. Addison's care had been before. So this is to say her care was scattered and uncoordinated is an understatement. There's a serious disservice being done to Mrs. Addison by the lack of communication between what Dr. Warner and his team knew and what Dr. Dingra knew and documented. And it's unfortunate Dr. Dingra had strongly recommended neuropsychology testing, that wasn't done. So there's a lot of unresolved matters regarding Miss Addison's psychiatric history that predated the injury and that has a serious impact on her current function.
What else?
That's it.
You're aware that before June 9, 2022, that she was gainfully employed?
She was at some point before the injury.
She was living unassisted.
Yes.
She cared for her grandchildren.
Yes.
She knew her grandchildren's names.
Yes.
She babysitted her grandchildren.
At times.
She was active.
Sometimes there were times when she was not able to be active based on her psychiatric records.
She was able to drive.
And she still is able to drive.
She was able to exercise.
At times.
Where you said she's still able to drive, your belief that she's still able to drive is based on what?
Her normal neurological exam, the fact that she is driving. I saw her video where she was driving.
You saw a video where she was driving?
I saw a video where she exited the driver's seat of a car and then went into a store and then went back to the car.
What's the date of that video?
I don't have it in front of me. It was sometime after the injury.
What kind of car was she driving?
I don't know.
Do you have the video there?
Pardon?
Would you pull up the video, please?
You're
And
talking
load
to
it
me?
into chat.
Who are you talking to?
You.
No, I can't pull up the video.
What do you mean you can't pull it up?
It's on I don't have the ability to pull it up on my laptop and share it with you. I'm sure others can find it for you and get it to you if you need it.
I saw the correspondence between you and Spencer Bowmore, and I didn't see anything in there about a video.
I shared it with him when we prepared for the deposition, James.
Okay. Just load it into chat.
Not sure how to do that. Can you give me a tutorial?
Just drag and drop. Pretty straightforward stuff. While he's doing that, you knew she worked over 50 hours a week?
Yes.
You disagree with the opinion in the medical record that the blood suffocated her brain?
I disagree with that.
Okay. You disagree that air pressure in the brain is harmful or can be harmful?
It can be, but it was a low pressure injection and there wasn't that much air based on the amount that he would have injected and the air that was seen on the CAT scan. So I don't think that amount of air would be harmful.
So were you able to open that video? Do you have it open?
Are you talking to Spencer?
You, yes.
Pardon?
Do you have the video open?
No, I'm not looking for it. Spencer was looking for it.
I'm asking you to look for it.
Or you want both of us to look for it?
Yes.
Why don't you
Is
give
it
us?
on your computer?
Uh, hmm. I had trouble opening it on my computer. I had it on my phone, so that's how I had opened it before.
All right. You have email on your phone, right? You have email on your phone?
I do.
So you can email it to me?
Um,
And I'll put it in the chat.
why don't you give me a couple of minutes and I'll work on this.
All right. Have you had any communications with Spencer while you're under oath in this deposition?
I have not.
Okay.
No, I haven't talked to him, James. Let's take a break. I'm going to see if
No,
Laura can
we're
help me.
Bonnie, we're going to stay on the record, but you go ahead and do what you need to do, doctor.
Right.
I'm going to see if Laura can help us as well.
Spencer, I messaged you in the chat instructions on how to do it.
I didn't understand it, so um let me pull it back up and see if you can talk me through it.
They did us the biggest favor.
Did you say you were putting your email in the chat?
Yes, sir.
I don't see it.
You want, here we go. I apologize. I didn't.
All right, so
There
I've
you
got the video up on my,
I'll get it from Dr. Sanders.
Well,
He's-
if
he's
it's
good.
already loaded, that makes it easier.
Bonnie, what are your instructions on what to do now that I've got it up? It's downloaded. It's on my screen. I've tried to drag and drop and it won't drag and drop, or it drops something, but you can't open it.
So what you need to do first is click the paper icon in the bottom of the chat.
Oh. Okay.
Thing that looks like a piece of paper.
Yeah.
And then search your computer for it, for the file.
You have your video open, Dr. Sanders?
I'm just trying to download on my phone so I can.
All right, just tell me what you see.
Well, it's just a little disjointed. If Mr. Bomar is,
No, I want the video that you've got there.
well, I want to see he sent me what I have. So it'd be helpful if we all look at the same thing.
What's that?
I just feel like this is a little disjointed. Can we just wait until Mr. Bomar uploads?
No,
the
sir,
video
I
so
want
we
the
can-
video that you reviewed. I want you to put it in chat or email it to me.
Mr. Bomar is doing that.
He can object. I haven't heard him object, but I want a copy of the video that you have.
Dan, you have a copy of the video he has.
Well,
We
we'll find out.
We provided that. So Bonnie, I've done what you said, and if you look at the chat, you can see there's two, looks like boxes that say Arlina Addison, AUG, and there's play buttons, but nothing's playing.
So you have to hit, once you have it loaded in the chat on your end, you have to hit the little paper airplane looking icon in the right corner to send it to everybody.
Oh.
And it might take a while. It could be kind of big.
Oh, I see.
You have the video open, Dr. Sanders?
It's my phone is busy downloading it right now.
Did you email it to me?
No, I did not.
Email it to me.
It's in the.
I'm gonna send it to you, James. I'm not gonna have Dr. Sanders communicating with you directly. I object to doing that.
Well, we're in a deposition. He said he's got it. So you're instructing him not to send it?
That's correct. He will.
No, that's
Not-
all I need on the record. And you instructed him not to send it.
That's right. You have it. So I've got two uploads of this video in the chat. The paper airplane thing says, it just kind of grayed out. It says Control plus Enter to send. I've got it in there 3 times.
Yeah, and here.
It says messages have a limit of 1,000 characters. So that's probably the issue. It won't go on chat. Why don't I do this? I have the ability to share my screen.
But he can email it.
I've already objected and instructed him not to, James. So
Okay.
I can share my screen if you'd like me to pull it up.
Yeah, that's fine.
Can you see it?
I can start it to, I can't control it though. You can start it at the beginning.
Yeah. You know that.
Let's go back to the beginning, please. Okay, pause it. You're gonna have to send it to me.
Well, I have sent it to you. That's the thing. I sent it to you, and it's just too big of a file to do it without compressing it.
This is the same video we've got.
Yes, it's the exact same video you've got.
Let's go ahead, Doctor. No, go ahead and start it, Spencer. Is this a video you saw?
Yes.
Okay, pause it, please. Show me where she's getting out of a car, out of the driver's side of a car.
Go back to the beginning.
Sure.
Well, she's walking from.
Pause it. Pause it. Yep. Go ahead, Doctor.
Okay. Yeah, I assumed that she was walking from the driver's side of a car. I didn't see her open the car door.
Well, you testified under oath just a moment ago that you saw her driving in a video. Was that a different video?
No.
So why did you suggest that this video showed her driving a car?
I assumed it was my mistake.
What?
I assumed it was in my memory. That's what I had remembered. I knew there was a car involved, but yeah, I don't see her driving.
Let's go back to the beginning. Show me the car involved. Just stop it right there. What car is involved, Dr. Sanders?
There's a car there, and there's another car at the end of the video. So maybe we could watch the whole thing.
No, go back to the beginning. And pause it. Yep. So what car is involved?
I said we see a portion of a car at the beginning of this video, and then there's another car at the end of the video. So I'd like to see the whole thing. You're asking about the car.
Okay. I don't see the time. Do you see the time on it, Spencer?
Yeah, 1:51 p.m. is what it says.
No, the time of the video. Are we like 4 seconds in, or is it 6 seconds?
2 seconds in.
I'm sorry, what was that?
2 seconds in.
Thank you. 2 seconds. So we're at the 2-second mark, Doctor. Tell me what car she got out
of. She didn't get out of a car that I could see.
Describe what car she was in.
All I could say was there's a car at the beginning of the video on the edge of it, and then it's a white. Are you gonna let me finish?
What?
There was a white car that's visible in the video in the beginning. Let's watch through the end, and I think another car will be.
Did you see her get out of a white car?
No, sir.
Did you see her get in a white car?
Could we watch the whole video?
No, sir. I want an answer now. Have you seen her get in a white car?
I don't remember.
Okay. Did you see her drive a car?
No.
Okay. Then why did you testify under oath just moments ago that you watched Arlina Addison drive a car? Do you understand how serious that is?
What I said was I thought she was capable of driving a car.
Oh, we'll pull up your testimony, your under oath testimony. You testified you watched her drive a car on video. Do you remember that?
No.
Okay. Go ahead, Spencer, if you don't mind starting it. Is that the end of the video?
It is
Okay. And what was that? How long was that? 64 seconds?
a minute, 4 seconds. Yes.
Thank you. Have you seen any videos of Arlina Addison other than that video?
No,
Sir?
no,
Okay. And did you see her get in a car?
no,
Did you see her get out of a car?
no,
Did you see her drive a car?
no.
Did you see her attempt to drive a car?
I saw her reach into her purse like she may be reaching for keys, so it's possible she was going to, but I didn't see her drive a car.
Sir, would you read back my question, please, Madam Court Reporter?
Question, did you see her attempt to drive a car?
Well,
Did you see
reaching
her
for
attempt to drive a car?
you know, when you reach for your keys, that usually is a sign you're going to drive a car, so that's close.
Show me the keys.
She's, you know, I'm not a detective, I'm just a neurologist. She's reaching in her pocketbook, going to the looks like the driver's side of a car. So I don't really think it's, you know, I that's all I can say is it looks to me like she might be driving a car that day.
Yeah, but you didn't see any keys in that video, did you?
Did not.
Okay. So you brought up keys. Are these things to try to help the defense in the case?
Of course not. These I'm making
Well, I mean,
objective.
you're here to give an objective opinion as a physician, right?
I am.
And the jury ultimately determines whether you're trying to color the facts of the case, right? You know how that works.
Very much so.
Okay. And
James, do you want me to unshare my screen now?
oh yeah, thank you, Spencer. I know you're not a videographer. But
I have very few skills when it comes to technology.
you're what?
I have very few skills, if any, when it comes to technology.
That's probably a good thing. So, were you aware that she's been surveilled since 2023?
No,
In 2023, 2024, and 2025, were you aware of that?
no.
Okay. Did you know that, do you have any idea how many hours and weeks and months that she's been surveilled?
I do not.
Okay. Does the video show her cognitive impairment?
No, it doesn't.
Okay. It doesn't give any information on damage to her frontal lobes, is that right?
Correct.
Okay. Or brain injury, is that right?
Yeah, well, there's no signs of brain injury on that. Her coordination and her gait and the way she held the door and held multiple packages. So those are all objective signs that there's no neurological damage visible by those efforts.
So you're saying based on the video, you can say there is no cognitive impairment, is that right?
It's not what I said.
Okay. Based on that video, you could not make any conclusions about her cognitive impairment, right?
Correct.
Okay. That's all I have. Anybody else?
Olivia, do you have any questions?
I do. I have just a couple brief ones. Dr. Sanders, my name is Olivia Beckett, and I represent Piedmont Healthcare in this case. I just have a couple of really brief questions about what you mentioned about Piedmont Healthcare. Will you just tell me, Doctor, what your personal knowledge, if any, that you have about Dr. Lee's employment status in June of 2022 is?
I have none.
Okay. Has anyone told you that Dr. Lee was directly employed by Piedmont Healthcare, Inc.?
No.
Okay. Have you seen any documents that identify Piedmont Healthcare as his employer?
No.
Okay. That's all my questions. Thank you.
I just have a few
follow-up.
follow-up. Do you want to go first, James, or do you want me to go?
Oh, you can go.
Okay. I don't have much. Dr. Sanders, I think this is in your prior testimony, but I just want to make sure we get all your opinions disclosed today.
Okay.
In your opinion, based on your review, did Ms. Addison experience a stroke or TIA following the cervical epidural steroid injection on June 9, 2022?
She did not.
The signs and symptoms she exhibited following that procedure, what would you describe that as?
I think it was a tonic seizure.
What is a tonic seizure?
Yeah, a seizure where there's a stiffness of the body along with loss of consciousness and some incontinence. And then and then like most seizures due to transient injury, people are back to normal within some minutes. Or let me say significantly improved within some minutes and then no permanent effects.
Okay. You had mentioned you were asked about the subsequent imaging done following the cervical epidural steroid injection on June 9, 2022. Did that subsequent imaging that you reviewed include CT and MRI imaging?
Yes.
Did you review those studies?
Yes.
Is there any evidence of brain damage on any subsequent imaging study following the June 9, 2022 CESI?
No, there's not.
You were asked about, or at least the MOCA exam that Dr. Dingra did came up a couple times. Did you see her notes that included the MOCA exam?
Yes.
Did Ms. Addison's neurologist do a neurotrax test? Did you see that in the records?
Yes.
How would you describe a MOCA exam or neurotrax test in terms of its significance?
Yeah, I mean, they're both rapid sort of ways of assessing cognitive function. The neurotrax is less established, less standardized. It's not part of my practice ever, but the MOCA is a tool. But again, it's a 5 to 10 minute standardized test for cognitive function that can be influenced by many things other than just straight up cognition.
Is it a screening type tool?
Yeah, so that when it is in that way, in many cases it is, because when you find significant abnormalities, it doesn't tell you whether it's due to problems with psychiatric disease or with poor effort or didn't sleep well. So those are other factors that can cause a MOCA to be low.
From your review of the psychiatric records from Dr. Warner's office, did he do any kind of similar testing in seeing Ms. Addison prior to the CESI on June 9, 2022?
He did.
And how did that testing compare to the MOCA testing done after the CESI?
I mean, they're both simple ways of assessing cognitive function, and her cognitive function was abnormal. This is in 2019.
And to determine the exact nature of her cognitive dysfunction at present, whether it existed before the CESI or not, would you need a neuropsych exam to fully evaluate it?
Yes, you would actually need a forensic neuropsychology evaluation.
All right, so we talked about, or I think you've already testified about some of the pre-existing medical problems that Ms. Addison had, as evidenced in the psychiatric records, and the impairments associated with that. But I want to ask you about something different now. Was Ms. Addison a chronic pain patient historically prior to the CESI on June 9, 2022?
Yes, she was.
Did she have a pre-existing history of migraine headaches?
Yes, she did.
Did she take medications for the psychiatric issues, the chronic pain, and the headaches?
Yes, she did.
Would medications that Ms. Addison takes, or at times maybe isn't taking, impact her mental and physical capabilities?
Yes.
In your opinion, based on your review of the records, did the CESI on June 9, 2022 cause any physical limitation Ms. Addison now claims to currently experience?
No, it did not.
All of the opinions you've given today, unless you've explicitly said otherwise, have they been given to a reasonable degree of medical probability, meaning more likely than not?
Correct.
Thank you, sir. Those are all the questions I have for you.
I have a couple of follow-up questions. I'll show you what's been previously marked as, is this 10, Madam Court Reporter? 11, something?
It's 10.
10. This is the June 9, 2022 record. Can you see Dr. Lee's note? You see where it reads Arlina Addison?
Correct.
June 9, 2022. See here where your patient tolerated the injection, 90 to 120 seconds after the injection, patient expressed discomfort. She displayed transient decerebrate posturing. Do you see that?
Yes.
You see it reads parenthetically, arms upward, fists clenched, back arched, legs straight, and feet and toes down going. Do you see that?
Yes.
And you're suggesting that that is a tonic posturing and not decerebrate posturing. Is that right?
I would call it a tonic seizure rather than decerebrate posturing.
Okay. And cite for me in a treatise, a textbook, chapter in a textbook, grand rounds, suggesting that this description is a tonic seizure.
It's well-known, established neurology.
Cite a single reference, doctor. That's all.
Yeah. Mr. Potts, I'll be glad to get you the reference that describes exactly how a tonic seizure is described as arms upward, fist clenched, back arched, legs straight, feet and toes down going.
Okay. Where
I said I'll be glad to get that to you at a later date. I don't have it. I don't have a library in front of me here.
all right. Show you what's been previously marked as number 12,
11.
11. Have you seen Dr. Lee's CV?
I have not.
You see where it reads Piedmont up here in the top left corner?
I do.
See where it reads Orthopedic Sports Medicine?
Yes.
Young Suk Lee, MD, is that right?
Yes.
See here where it reads Piedmont Orthopedics?
Yes.
And the address, 455 Legends Place, Southeast Suite 890, Atlanta, Georgia, 30339.
Yes.
Okay. And is that the first time? Well, no, you realized before today that Dr. Lee was employed by Piedmont Healthcare, right?
Objective
Yes.
form.
And I'm going to show you another CV that we were able to obtain for Dr. Lee. This is number 12. See here where it reads work experience? Piedmont Orthopedics LLC, February 2020 to present. Do you see that?
Yes.
See where it reads OrthoAtlanta LLC, also January 2015, now January 2015, also to present, right?
Yes.
That's all I have.
Nothing further from me. Olivia, do you have anything else?
Nope, we're good.
Okay.
Be safe, doctor.
Thank you.
Okay, we're
Take
we're
care.
going off the record at 12:37 p.m.
Bonnie,